Dimethyl sulfoxide, DMSO, revisiting its therapeutic potential in cancer and radiation protection. Introduction. Dimethyl sulfoxide, DMSO, a highly polar organic compound derived from lignin, a component of wood, gained medical interest in the 1960s due to its extraordinary ability to penetrate biological membranes and transport small molecules. Though initially lauded for its anti-inflammatory and analgesic effects, controversy and regulatory challenges slowed its clinical adoption. However, a growing body of research now revisits DMSO's broad therapeutic potential, especially in the areas of cancer therapy, radiation protection, wound healing, and immune modulation. This article explores recent scientific insights into DMSO's application in oncology and radioprotection while addressing concerns surrounding its use, particularly in combination with chemotherapeutic drugs. DMSO in cancer therapy. Emerging evidence suggests that DMSO may act as a promising adjunctive agent in cancer care. One of its key benefits appears to lie in its ability to influence cellular differentiation and suppress tumor progression. DMSO has been shown to modulate gene expression, particularly in relation to tumor suppressor pathways. In lung cancer models, for example, it was found to enhance the function of HLJ1, a tumor suppressor protein, via activation of the ERK and AP1 signaling pathways. This leads to reduced cancer cell proliferation, invasion, and migration, all hallmarks of malignancy. Some studies indicate that DMSO may promote apoptosis-programmed cell death in tumor cells, an essential mechanism in controlling tumor growth. Additionally, DMSO may disrupt the cancer cell's ability to form colonies, which is critical in preventing metastasis and recurrence. Nevertheless, while these results are promising, it is important to note that much of the data stems from preclinical or in vitro studies. Translational research and human clinical trials are still limited, emphasizing the need for caution and further investigation before DMSO can be widely recommended in oncology. Radioprotective properties of DMSO. One of the most compelling applications of DMSO lies in its radioprotective properties. Ionizing radiation causes oxidative stress and DNA damage, which can harm healthy tissues, especially during cancer radiotherapy or exposure to medical imaging. DMSO, due to its strong free radical scavenging capabilities, has demonstrated effectiveness in protecting biological tissues from this damage. In a notable animal study, a single oral dose of DMSO provided complete protection to mice subjected to otherwise lethal radiation levels. These findings support its potential use in protecting bone marrow and other critical tissues during radiation exposure. Moreover, DMSO has been shown to prevent radiation-induced oral mucositis, a painful side effect of head and neck radiotherapy, by reducing inflammation and oxidative injury in epithelial tissues. Such findings not only position DMSO as a valuable support for cancer patients undergoing radiation therapy, but also raise its relevance in the context of accidental radiation exposure or radiological emergencies. Interactions with chemotherapy. Despite its protective and anti-cancer properties, DMSO presents complex challenges when used alongside chemotherapy. Several studies have found that DMSO can interfere with the cytotoxicity of platinum-based chemotherapeutic agents like cisplatin and carboplatin, both of which are mainstays in cancer treatment. Specifically, DMSO has been shown to inactivate these compounds by binding to their active components, potentially reducing their effectiveness. Moreover, DMSO may alter the differentiation status of certain cancer cells, inadvertently promoting drug resistance. In human embryonal carcinoma cell lines, for instance, DMSO exposure resulted in increased resistance to chemotherapy drugs. These findings highlight the importance of contextual caution and underscore that DMSO should not be combined with certain treatments without careful evaluation. Therefore, while DMSO holds therapeutic potential, its use must be highly individualized, and clinical decisions should consider potential drug interactions and tumor biology. Wound healing and post-surgical applications. In the area of wound healing, DMSO shows encouraging results. Its anti-inflammatory, vasodilatory, and analgesic properties make it effective for improving post-surgical recovery and managing chronic wounds. Research shows that DMSO enhances the proliferation of fibroblasts and keratinocytes, two cell types essential for skin repair and regeneration. These effects may translate to fewer post-operative complications and improved tissue recovery, especially in cancer patients undergoing surgery. Its capacity to reduce inflammation, manage pain, and enhance cellular repair makes DMSO a potential topical agent in wound care protocols. Conclusion: Dimethyl sulfoxide is a versatile compound with a wide range of biologically active properties, from enhancing the immune response and improving tissue recovery to protecting against radiation-induced injuries. DMSO holds real promise, particularly in cancer therapy and radioprotection. However, its potential to interfere with certain chemotherapy drugs and induce resistance in specific cell lines calls for careful clinical consideration. Current evidence supports its use in certain niche applications, but larger, well-controlled human studies are essential to fully validate its safety, efficacy, and best use scenarios. Until more robust clinical guidelines are established, DMSO should be viewed as a supportive investigational tool, one that may benefit select patients when used under medical supervision.